everyone, my name is Huma Haq and I am the Care Officer here at PSI. In the first 2 weeks in June, PSI will be taking part in the International Labour Conference here in Geneva with a delegation of care workers such as nurses, long-term care workers and community health workers from a range of countries such as Burkina Faso, Nepal, Brazil and the Philippines. The annual conference brings together government, workers and employees delegates to discuss and negotiate fundamental labour and social issues. But this year there will be a general discussion specifically on decent work and the care economy. PSI is one of the largest representative bodies of care workers. We're advocating for a radical new approach to care that not only values and supports its workforce, but also delivers better quality care for all. The level of care that people need is growing globally. We must fight for quality publicly provided care services where workers are paid properly and treated with respect. For 2 whole weeks in Geneva, our members will join negotiations to influence the outcomes of the general discussion, securing commitments for quality care services and decent work for all care workers. These outcomes will set the future direction of the ILO and its work on care. At PSI, we are calling for the following: commitments on improving wages and conditions, addressing staff shortages, fair and ethical recruitment of migrant workers, access to training and promotion opportunities, formalisation of care workers, freedom of association and respect for collective bargaining. We must reclaim the public nature of care services and restore the duty and the primary responsibility of the state to provide quality care. We want the ILO to hold a tripartite meeting on care as a public good, on the right to care and on the state's main role in regulating care services. They must examine public investment for public provision and how funding and provision impact workers and service users. Finally, our affiliates are fighting for the formal recognition of community health workers to be seen as workers and not volunteers. They are struggling for decent pay and access to social security, including healthcare and pensions. They need adequate training and protection against violence and harassment. Community health workers are travelling to Geneva to tell member states that they need to ensure that community health workers are included in national health and care policies and in social dialogue. The community health workers will present their Charter of Demands to member states, urging them to respect, promote and protect their rights as workers. You will be able to see our full position paper on the general discussion on PSI's website. Follow our social media channels for live updates from the conference.